Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the hepatolenticular degeneration, also called the Wilson disease. This is an autosomal recessive disorder of copper metabolism. There will be accumulation of copper in the liver, in the cornea, in the brain, and in the kidney. There is defective gene, that is ATP7B locus, is located in the chromosome number 13, decreasing binding of copper to the transport protein ceruloplasmin, and also decrease of biliary copper excretion. So there will be excessive accumulation of copper in the system, damages the liver and basal ganglia, especially the lenticular nucleus of the basal ganglia. So it is called hepatolenticular degeneration. So what are the clinical findings of Wilson disease? It is a hepatolenticular degeneration. So liver and the brain will be affected. Liver, what happened? There will be initially fatty change in the liver, steatosis, jaundice, and the symptoms associated with jaundice like anorexia, nausea, distaste for food, altered liver function test, cirrhosis of liver will happen. There will be fibrosis and necrosis in the liver substance, and there will be portal hypertension, and there is also splenomegaly may happen. Neurological manifestation, neurological presentation, there will be movement disorder. Why? Because the basal ganglia is affected. So there will be tremor, ataxia, rigidity, dysarthria, dysphagia, difficulty in swallowing, dysarthria, difficulty in speaking, choreiform movement, that is dancing movement, that may happen due to Wilson disease. Okay. So if we go here, clinical finding of the Wilson disease, if we continue, this is very important. We never miss this part. This is important. This is the Kayser-Fleischer ring here. This is the Kayser-Fleischer ring. It is in the cornea, in the decimus membrane, near the sclerocorneal. This is the sclera. This is the cornea at the sclerocorneal junction. This is the Kayser-Fleischer ring. This is very much diagnostic for the Wilson disease or hepatolenticular degeneration. We have other problem may happen in the eye, that is the sunflower cataract. That is the opacity of the lens of the eye. It looks like a sunflower cataract. This is very important, the Kayser-Fleischer ring. This is very common in case of Wilson disease, hepatolenticular degeneration, and it is better to observe this case of ring by a slit lamp. Okay, so what happened? It is a hepatolenticular degeneration. So lenticular nucleus are affected, caudate nucleus are affected, as a whole the basal ganglia is affected. So we have the hepatolenticular degeneration as because the basal ganglia is affected, we will have abnormal movement. We have rigidity, we have epithetoid movement. In our patient, we'll get the epithetoid movement, rigidity. We'll get in our patient tremor, that is a feature. Okay, so also there will be choreiform movement. This will happen in a patient due to the damage to the basal ganglia. This is basal ganglia. These are present around the ventricle of the brain here at this section, midsection of the brain. Okay, so we got that. Now we go to the psychiatric presentation. Okay, there will be depression, obsessive compulsive disorder, psychopathic behavior, dementia. Person will have cognitive failure and loss of memory both. mental slowness, psychosis with hallucination like that of schizophrenia. Other features are hemolytic anemia, may be related to hepatosplenomegaly and portal hypertension. Renal disease will get Fanconi's syndrome that will be associated with that of hematuria, phosphaturia, and also renal tubular acidosis. Cardiomyopathy may be may be associated with Wilson disease and arthritis, joint pain, inflammation of the joint, cardiomyopathy. There is the weakness and the pathology in the cardiac muscle. So, what are the laboratory tests to diagnose Wilson disease or hepatolenticular degeneration? As because there is excessive accumulation of copper in the liver, so we'll get abnormal liver function test. Low serum ceruloplasmin level. This is very important to metabolize the copper, ceruloplasmin. This will be low in a patient with Wilson disease. High urinary copper excretion. We collect 24 hours urine and we find out the copper level in a patient's 24-hour collection of urine. Biopsy, if we do the hepatic liver biopsy, we'll get focal necrosis and cirrhosis. Necrosis means cellular death or nuclear death of the cell, especially the death of the hepatocyte. And in cirrhosis, there will be proliferation of the fibrous tissue and death of the hepatocyte, the necrosis. High hepatic copper content is also found in biopsy, and MRI of the brain will show there may be cavity formation in the putamen or in the caudate nucleus, and this may be atrophied, this basal ganglia. Okay, what is the management of Wilson disease? It is a disease of accumulation of copper. Copper is a heavy metal. We like to get rid of the copper by giving chelation therapy. One is penicillamine, another is trantin. This drug has adverse effect like that of aplastic anemia and leukopenia, thrombocytopenia. So it should be watched very closely, the adverse effect of this drug. This drug has also some adverse effect. And management, zinc therapy is good. Zinc will prevent the reabsorption of copper in those patients and restriction of copper rich diet. And at last resort, liver transplantation is a management for Wilson disease or hepatolenticular degeneration. So we got the images from multiple resources. My images I took from the Microsoft PowerPoint. And that's all for today about the Wilson disease or hepatolenticular degeneration. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me and have a nice day. Bye now.